Injuries of the cruciate ligaments. This common condition usually occur in athletes as footballer, basketballer, handballers, etc. Anterior cruciate is usually affected. Why? The trauma of the anterior cruciate is the same as the medial meniscus. Severe twisting trauma of the leg. And the posterior cruciate is affected by trauma to the anterior aspect of the leg. What is the function of the cruciate? To remember the trauma causing this injury. During doing this test, if you pull the leg forward, you think that the tibia will move in your hand and comes forward with you? Never. What prevents the tibia to slide anteriorly on the femur? Anterior cruciate. Beside anterior cruciate also give a twisting stability to the knee and prevent excessive twist. Therefore, anterior cruciate becomes stretched if there is any tendency for the leg to move anteriorly, or it becomes stretched also if there is twist of the leg. The reverse is posterior cruciate. If you try in this test to push the leg posteriorly, you think that the leg will move posteriorly? Never. Because if you try to push the leg posteriorly, this leads to stretch of the posterior cruciate. Therefore, any sliding movement of tibia anteriorly or twisting is the function of the anterior cruciate. Any sliding of tibia backward is prevented by the posterior cruciate. Therefore, in any severe twisting trauma, usually anterior cruciate will injured, or if there is excessive posterior movement of the leg backward as trauma to the front of the leg, severe trauma to the front of the leg, will push the leg posteriorly with stretch of the posterior ligament and rupture of the posterior ligament. And the anterior ligament is much more affected than the posterior ligament. What is the clinical picture of injury of the anterior and posterior cruciate? As usual, it is a sport injury. History of characteristic trauma. The player suddenly feel severe pain in the knee. Fall on the ground and they cannot resume the match. Ask the patient what you feel or what you hear during the pain. The patient will tell you that he hear a popping sound. Boom! During rupture of the ligament. If the patient try to stand, the leg may be due to sliding of tibia. The patient usually collapse in the ground again. This condition is usually followed by swelling in the knee, rapid development of swelling in the knee, which is hemoarthrosis. To diagnose cruciate injuries, there are two characteristic tests. The first test is characteristic for the commonest injury, which is the anterior cruciate, called Lachman's test. What is Lachman's test? With the patient supine, put the thigh and the leg in 20 to 30 degree flexion, and hold the lower part of femur by one hand and hold the upper part of tibia by the other hand, and move the two hands in opposite direction. The hand holding the femur push backward, and the hand hold the tibia push forward. If there is detectable abnormal anterior movement, this indicates injury of the anterior cruciate. If there is a sliding or gliding of tibia forward, this means injury of the anterior cruciate. In the same principle, there is drawer's sign. Drawer's sign puts the thigh and leg in 90 degree flexion. Hold the upper part of tibia and try to pull the tibia forward. Any sliding of tibia forward means rupture of the anterior cruciate, and try to push the tibia backward. If you can push the tibia backward, this means rupture of the posterior cruciate. What is the investigations? As menisci in any intra-articular injury of the knee, MRI and arthroscopy are the best investigations. Treatment: conservative. Initial treatment is menisci: rest, ice, compression, elevation, analgesics, non-steroidal anti-inflammatory drug. Fix the limb by a bandage for 2 to 3 weeks, followed by physiotherapy to strengthen all muscles of the knee region. This is usually sufficient and perfect for the posterior cruciate. But in case of injury of the anterior cruciate, if this conservative treatment fails, or the patient is athletes, requires the full knee joint function, surgery should be done, and as usual, arthroscopic treatment. Posterior cruciate rarely need surgery. The same idea in anterior and posterior cruciate. The ruptured ligament should be removed, and after removal of the injured ligament, the ligament should be replaced by tendon graft. From where? The tendon in the knee region, which is called patellar ligament or patellar tendon or ligamentum patelli. We take the middle third of the patellar ligament with part of bone below and above, and we make a tunnel between femur and tibia to insert the new ligament. At the end of the operation, very easy repair of the patellar ligament. And the same for the posterior ligament. Remove the posterior ligament, replace by a tendon graft from patellar ligament, and replace the graft, the tendon graft replace the posterior ligament. This is the anterior and posterior cruciate ligament. Thank you for good listening. and good luck.